Doktor kliniğinde uzman doktorlardan önemli bilgiler almaya devam ediyoruz. Lordshıp Lane'de bulunan klinik anında randevu alma imkanı sunuyor efendim. Ürolog Doktor Ormanov önemli bir konuyu gündemine taşıyor bu hafta: prostat.
Hello, my name is Dr. Doktor Ormanov. I'm urologist here at Doctors for You, the private clinic. I'm a urologist with more than 20 years experience in the field, and a part of being urologist at Doctors for You, I'm also an NHS consultant. So today I would like to speak about the one of the most precious things for men, which is the prostate. And this is because next month in November there is a new trend from a few years now called Movember, with M, Movember, which is a month for awareness for male disease such as prostate cancer, testicular cancer, and disease related to men's health. So first thing is I need to speak a bit more about the prostate. What is prostate? Prostate is an organ which every man has, and it's in close relation to the bladder. Actually, it sits in front of the bladder, and it has a vital role for ejaculation and for sperm production. Long story short is that the prostate is responsible for the liquid part of the man's ejaculate. At some point, the prostate with the age starts growing, because the prostate's anatomy consists with the prostate consists of glands and muscles. The muscle part of the prostate is responsible for ejaculation, is a part of the ejaculation process, and the glands of the prostate start growing with the age. This is where the so-called prostate symptoms start. There is no recipe or any formula about the prostate, when the prostate problems start, and how long is it going to take, or what symptoms every man is going to have. It's different for everyone. Some men are worried to talk about prostate, about their urinary problems and prostate problems. The prostate usually, the first symptoms of the prostate is weakening of the flow, as well as night wake-ups, or so-called nocturia, where the patients start being aware that there is something different going on at this stage. It is very important for the man to know that the prostate does not take any part of the erection. Prostate is not responsible for your erections. If you have problems with the erections and you feel this is because of the enlarged prostate, I want to make you aware that this is not true. Prostate is not responsible for the erections. Enlarged prostate is not a disease. This is also another message. You need to know that the enlarged prostate is just a condition. It's not a disease. What are the symptoms of prostate enlargement, or so-called prostate symptoms? This is the weakening of the flow. This is the nocturia. Some men might wake up once, twice, 3 times. This is the feeling of not completely emptying the bladder. This is so-called dysuria, and in some cases where the prostate is really very big and is causing storage struggles, is when the flow starts and stops, and the end stage is if the man leaves ignores his symptoms for a long time, they may fall into so-called urinary retention or inability to empty the bladder, which is a condition usually treated on first instance with catheter, and then possibly with surgery. So it's important to how do we diagnose the prostate problems? Prostate problems is conversation with the patient. examination, which is using an ultrasound scan to measure the size of the prostate, as we need to know what exactly we need to know about the size of the prostate, and this is also in direct relation with the treatment, which and helps us to choose the correct treatment. We also check the size of the prostate we examine the prostate through the back passage, and very important, we ask every patient having a so-called lower urinary tract symptoms or symptoms related to the prostate is so-called PSA test, which stands for prostate specific antigen. This is a test which gives us valuable information about any internal problems, and the elevation of these tests might be a sign for awareness and might prompt further investigations for prostate cancer. It is very important to know about the prostate cancer, because the prostate cancer does not have any specific symptoms. All the symptoms, the prostate cancer is a tissue diagnosis and is usually diagnosed with a prostate biopsy and MRI scan. This is something which needs to be done in case the PSA levels are really elevated. So how we treat the prostate symptoms? The prostate symptoms are usually treated with medication. We have a very effective medication to relieve the symptoms, but it's really very important for the man to know that there is no medication, there is currently no medication which can stop the growth of the prostate. There is a medication which relieves the symptoms and can slow down the growth, but not to stop it completely. There are a lot of tablets on the market which are sold for prostate symptoms. Some of them are sold over the counter, some of them are prescribed by doctors. The tablets which are freely sold and you can buy elsewhere are usually herbal medication. Some of them are with no proven effect, and taking of such tablets might not relieve the symptoms and might not help. Taking such tablets might not relieve the symptoms and might not help. I would recommend for everyone who has a prostate problems or problems with or urinary symptoms. I would recommend every man having urinary symptoms to seek for specialized urology advice. This is always important and does not need to be delayed. Many men delay their visit to the urology office as they're usually ashamed or they ignore their symptoms. It's always important to know that having lower urinary tract symptoms need further investigation and might prompt some and might require some further imaging and blood tests and early start of treatment.